Assalamu alaikum, I am Dr Junaid, Jahangir Abbasi, and I am Senior Registrar in Pediatrics at Rawalpindi Medical University. Today we are going to do abdominal examination. First step is introduction, consent and proper exposure. Assalamu alaikum, मेरा नाम Dr Junaid है, मैंने आपको मुआयना करना है, इंशाल्लाह दौरान मुआयना आपको तकलीफ नहीं. In examination, the first step is inspection. So inspect the abdomen from the bed end, then inspect it from the foot end. Look for any visible scars, deformity, distension. Note the shape of the umbilicus and look for any overlying redness, oozing, rash, etc. Once you have done with the inspection of the abdomen, you will do palpation of the abdomen, and before palpating the abdomen, just rub your hands so that you may not touch with the cold hands. On palpation, first of all, I will do superficial palpation in an S-shaped manner, then I will do deep shaped palpation in an S-shaped manner. While doing the palpation, I will look into the eyes of the patient and I will make sure that I can note if there is any tenderness or something like that. I will come to the level of the patient. I will look into the eyes and I will do the superficial palpation. Then I will do the deep palpation. And I will try to find out whether there is a mass present or not, or is there any distension or tenderness anywhere in the whole of the abdomen. Once I have done with this palpation, I will go check the visceromegaly. First of all, the hepatomegaly. When I get the lower edge of the liver, then I need to take the size of the liver, how much it is below the lower costal margin. I need to see whether the edges are well defined or ill defined, whether it is smooth or rough or firm, whether it is soft or firm, whether it is tender or not. And then I have to take the total span of the liver. For total span, I will start percussing from the second intercostal space, then I will come down. The point where I get the dullness, I will note that point, and from that point to the point where I got the lower margin of the liver, I will measure the span of the liver. So this is the total span of the liver. After checking the hepatomegaly, I will start palpating the spleen. And the palpation of the spleen starts from the right iliac fossa, then I will go towards the left hypochondrium. During palpation, I will again look into the eyes of the patient to see is there any tenderness. Once I will feel the lower border of the spleen, I will again measure the spleen and I will look how much it is below the left costal margin, and then I will check the surface of the spleen, is it smooth or firm. I will palpate for the splenic notch and I will make sure that I can't get above the border of the spleen, because when it is splenomegaly, you can't go above the border of the spleen. So once I've done the spleen, then I will palpate the kidneys bimanually. I will put one hand below the kidney and with the other hand I will palpate the kidney. I will palpate both the kidneys. Then I will check for the ascites. In order to check the ascites, I will start percussing from below the xephisternum Once I reach to the right side or maybe the left side, I will ask the patient to go in left lateral position. बेटा उस साइड पे साइड ले लें ऐसे साइड ले लें हाथ इधर रखें ऐसे साइड ले लें शाबाश. I will wait for few seconds so that the ascitic water may go to the other side, and then I will percuss it again. So if after making the patient to the left lateral position, the sounds get more pronounced, more prominent, that means that the shifting dullness is positive. There was fluid in the right side. When I made the patient turn to the left side, the fluid went to the left side and the sound became more prominent. The sound of percussion note becomes more prominent. That means that the shifting dullness is positive. It is present. Now you may also check the thrill. However, the shifting dullness and thrill may not be present at the same time. But in order to complete the steps of examination, check for the thrill also. बेटा अपना हाथ ऐसे रखेंगे, शाबाश. ये रख दो, कोई मसला नहीं. ये रख दो. Ask the patient to place one hand right in the middle of the abdomen. Place your other hand over there, and then do a splash-like movement. And with this hand, with the palm of this hand, you will feel the fluid thrill. But it will be present when there is massive distension, when there is massive ascites. So after checking the fluid thrill, now I am going to percuss and check the bladder. First of all, palpate the bladder with this movement coming from above. Do like this. Feel the edges and borders of bladder. Then percuss the bladder. So if the bladder is distended, the percussion note will become dull. After checking the bladder, gently take up the trouser, look for hernial orifices, look for any genital abnormalities. Ask the patient to place the hand on the mouth and do a cough. Beta khansi karo. When he coughs, look for the hernial orifices. Then also examine the inguinal lymph nodes, as this is as part of relevant examination. Then auscultate the abdomen. Once you have done with the percussion and palpation, auscultate the abdomen. Auscultate the hepatic area for the hepatic bruit and both the renal areas for the renal bruit. And then auscultate for the presence of bowel soaks. Once you have done the auscultation of the abdomen, you need to see the other relevant examination pertinent to abdomen, like go downwards and look for abdema. Press for a few seconds at both the medial malleolus and look for edema. Look at the hands for any caronychia, pallor or clubbing. You may check the BCG scar and then look at the eyes for jaundice and anemia also. And then you may, if you get the inguinal lymph nodes enlarged, then it is also relevant to check the cervical and the axillary lymph nodes. And then look at the spine. Ask the patient to turn. Look at the spine, the sacral edema, and then cover the patient and say, "Thank you so much."